I think a very important thing here is to understand that you have a small number of outbreaks, particularly in a couple of families. And so where there are a couple of families, you have to do three things. First, to focus on those families and to test and to trace. The Victorian government is doing that, and we have offered all support to the Victorian government. The Prime Minister has offered the Premier of Victoria all of the support. If they need military support, if they need AUSMAT support, if they need contact tracing support. Already the contact tracing support, public health official units from other states have been accepted by Victoria, and I welcome that. Secondly, there is the specific engagement with communities, and so with respect, the error in the report is a complete failure to recognise that there's been direct community engagement as well as national level engagement, and so within the specific communities in Northern Victoria, there's been engagement led by the Department of Home Affairs and Migration, but also the state authorities, and so it's been done in parallel. And then the third thing is, as I say, the national program, which started before, continued on. So I spoke to the head of the body this morning, Professor Michael Kidd, who did the report, and he said it had been completely misrepresented on the ABC, and he was very upset and very disappointed as the person who was the author of the report that such a statement could have been made. He realised it must have been made in good faith, but inadvertent, and was an error, and he was seeking a correction from the ABC.
Would you say then that your engagement with these diverse communities is more than adequate? Is there any room for improvement? Every day, on every front, we're working harder. We're encouraging the Victorian government to do more on the ground. We're offering our support. But at 4,300 engagements, at 850,000 page views, we have been a world leader. I think one of the things here is when you look around the world and you see what's occurred, overseas, roaring past 9 million cases. The rate of growth is actually accelerating around the world. And yet in Australia, the achievement we have had is precisely because we have engaged with these communities. If there's an individual family where they have not observed the distancing behaviours, then there's a mixture always of extra information but personal responsibility. And one of the things we know that has happened, and this was set out in research that was published today, is over recent weeks, particularly since the protests, many Victorians and many Australians have said, gosh, if it's okay for 10,000 people to congregate and huddle together, surely it would be okay for 10 in my family. And the message is it was never okay for that protest to have gone ahead, not because of the subject matter, noble, powerful, important, but because of the fact that 2.5 weeks later, we have had an outbreak in Victoria. In part, we know that there are 4 cases directly linked with that protest, but we also believe that there has been a significant relaxation in parts of the public as a consequence of the double standard. So the message is, please keep your distance. It's vitally important. It can save your life. It can protect your life.
Should Victoria go back to stage 3 restrictions? Should the other states be blocking Victorian travel?
I think everybody needs to recognise that Australia has done well and continues to do incredibly well. We always warned back in February and March and April that no matter how well we did, there was the potential or risk of spikes or outbreaks. And that's what we're seeing. And in order to deal with that, that was why we established rapid testing, rapid tracing, and rapid local responses. That's what we did in northwest Tasmania, and we were able to control that outbreak. That's what we did in Western Sydney, and we've been able to control those outbreaks. And that's what's being done here in Melbourne. I want to thank the public for seeking the tests and their patience in that. That testing, is arguably the best testing program in the world, and it's what's helping to protect Australians and keep them safe.
You've got people waiting 4 or 5 hours for a test, though.
I think one of the things here is people have responded, and there are multiple places where testing can occur. So it's very important to go to health.gov.au or dhhs.vic.gov.au, and they set out the almost 90 testing sites that are available in Victoria, as well as going through your GP, because many general practices are linked directly to pathology collection centres, and that may not be known to the public. Not every general practice will necessarily want to see somebody or be in a position because of their physical circumstances to do it, but call your GP or look at the health.gov.au or dhhs.vic.gov.au, and so there are multiple avenues for testing, not just a couple. Okay, I'll go to those that are online. Candice?
Good morning, Minister. As you say, Victoria has recorded another 20 coronavirus cases today, as well as another death, sadly, the first in many weeks now.
Yes.
My question is twofold. How do our rates of community transmission sit with you, both as the Federal Health Minister and as the Victorian? And do you think Victoria's figures have the nation concerned?
Look, firstly, I think it's important to acknowledge a 103rd death in Australia, the first in some weeks. So that's a source of deep sadness for the family, but also for the nation. Secondly, this reminds us it is a global pandemic, and there were some who may have believed that we were going to be completely out of the woods. That has never been the case. That was why the protests were not a safe thing to do. That was why we've maintained throughout all of this, and I said in Parliament, and the Prime Minister said in Parliament, and we've spoken widely, that we must keep focusing on our 1.5 metres, on the physical distancing, which is so unnatural but so vital to our future. So we remain concerned about the level of cases. They remain at a low level in the discussions with the Chief Medical Officer only this morning. However, this is a critical juncture, and I do believe that's the case. We can continue to work to bring these cases down, to suppress the case numbers in Victoria. As a country, we've done extraordinarily well, but we don't want to judge any individual state or territory where there is an outbreak, because that's what can happen. It can literally take one person who doesn't do the right thing, one person who doesn't even realise that they have symptoms, because it is a disease which can transmit at the late stages of being asymptomatic. And so it's not a case to judge one state for the circumstances they're in. It's our duty to help that state at that moment, which is why we've been coordinating national action, and the Prime Minister has offered AUSMAT, the Army, contact tracing support, whatever is needed by Victoria to assist. Dana?
Thanks, Minister. Could I ask you to shed some light on the discussions between the federal and Victorian governments on the hotel quarantine breach? Is the Victorian government too proud to ask for military help? Do we need to start diverting flights from Melbourne? And are you confident that the security company contracted by the Victorian government to run its hotel quarantine is actually competent at running this operation?
Sure. So the Chief Medical Officer took to the medical expert panel the question of standards in hotel quarantine. All of the states and territories work together. This will become an increasingly important part of our defence mechanisms. We know there was a breach within the Victorian context. Again, no blame. It's a fact. And so what we have to do is ensure that those standards in the hotel quarantine are absolutely at the highest level. So we've offered support, and it's entirely a matter for each state and territory to determine their particular needs at that particular time. In northwest Tasmania, we had an AUSMAT team, so the medical assistance team. Think of it as they've been described as the SAS of infection control, come in with military support underneath simply for logistics. So Victoria is a great state. They have done an extraordinary job so far, overwhelmingly an extraordinary job, and I think it's very important as a Commonwealth Minister to put that on the record, as have all the states and territories. Our resources are available. Victoria has already accepted support with contact tracing from New South Wales and South Australia, and we work as one single country. And when somebody needs the help, we're here to help, and they will accept and ask for what it is that they need, and I'll leave it to them to determine that. In terms of flights, we just work very constructively. You have a mixture of commercial and specific repatriation flights. The commercial flights obviously have their destinations. The advice I have this morning is there's no plans at this stage to change the destination for any of those flight arrivals. If either the Commonwealth or any state had concerns, then that would be easily resolved. Okay, Tom.
Thanks, Minister. Just a couple of questions. Firstly, following on from that, is there a point where you see we still have issues in hotel quarantine in Victoria and breaches happening where you would actually like to see flights diverted so you can be assured that those arrivals are going into a safe place? And secondly, just on the effective reproduction rate of the virus, we've seen Victorian authorities saying this morning that that's now up above 2, even at 2.5, and obviously you wanted it 1 or below. If it remains at that level, does that sort of change how the National Cabinet views easing restrictions, and does Victoria potentially have to pull back even further if they're unable to get that number under control?
Sure. So firstly, in terms of hotel quarantine and flights, our job is to ensure that each of the states is maintaining the standards. That's why the Chief Medical Officer, Professor Murphy, took the question of hotel quarantine specifically to the medical expert panel in recent days. The purpose of that was to ensure that all states were at the highest level, and I think the different state chief health officers have taken on board the suggestions and standards of each other, but we've offered assistance in terms of OSMAT or infection control specialists to be available. But Victoria does have extraordinary people. I think the key thing here is to make sure that the particular security companies are up to standard, and if they're not up to standard, to ensure that somebody else is in place. And, you know, if at any stage any state is struggling, then we're very open to them talking to us. We haven't had that notion yet that any state is struggling. There's been an outbreak. Somebody has either not known or not done the right thing. So we need to be honest about that, but we need to keep in perspective that Australia, by global standards, is doing extraordinarily well, and we will continue to do well. But locally, and this goes to the second part of your question, if you had a continued and prolonged case of what's known as the effective transmission rate being higher than 1, sustained and significant. So you've got to have sustained and significant, because if it's very low numbers, as the Deputy Chief Medical Officer, Dr Nick Coatsworth, said to me today, then that can literally be within 1 or 2 families. But if it's sustained and significant, then you have a case for a local lockdown, because the model we've designed is rapid testing, rapid tracing and the capacity for local responses. So a local lockdown has been specifically identified by Victoria. That's the structure that the National Cabinet and the Medical Expert Panel have put together. I think there's one more here.
Just how concerned are you about that reproduction rate of 2.5, given that we want to stay around about 1 level?
Yeah, it's obviously amongst a very, very small community, including a series of families. So those families where there's physical proximity and physical contact are the most likely place for transmission. Having said that, our approach here is that we want to see that there is active suppression of these cases, that all of those families are fully contact traced, and then what's occurring in literally the suburbs around us at the moment, the testing and the tracing and the active focus on those communities is continued. So it would need to be something which was sustained and significant. At the moment, it's early days, and the numbers, according to the Deputy Chief Medical Officer, are low. Ultimately, we have a task, and that's to keep each other safe through our practices. As we said at the outset, there would be spikes and there would be difficult days. This is one of those spikes. It is one of those difficult days. But more generally, my view and our advice is that Australia is as well placed as any country in the world. As we saw from the international economic advice overnight, and as we see from the repeated views from around the world of Australia compared with what's occurring. So there's more work to be done, but as one single country we'll continue to do that. Thank you very much.